Learning objective. At the end of the lecture, students should be able to elaborate the bones which are responsible for forming these arches, to describe the ligaments which are holding these arches, describe the function of the arches of foot, and in the end to describe the plantar fasciitis. The foot is the region of the body which lies distal to the leg. They are flexible structures of bones, joints, muscles, and soft tissues that let us stand upright and perform activities like walking, running, and jumping. It is divided into three sections, that is the forefoot, the midfoot, and the hindfoot. When we talk about the forefoot is made up of phalanges and the metatarsals, whereas the midfoot is made up of several bones like the three cuneiforms, that is the medial cuneiform, the intermediate cuneiform, and the lateral cuneiform. In addition to it, the midfoot also contains the cuboid and the navicular bone. So they are altogether five bones which forms the midfoot. The forefoot is formed by the phalanges and the metatarsals, whereas the midfoot is formed by the three cuneiforms, that is the medial, intermediate, lateral cuneiform, cuboid, and the navicular bone. Whereas the hindfoot, this is the hindfoot. The hindfoot comprises of two major bones, that is the talus and the calcaneum. This is the talus and the calcaneum. Talus together with the bones of the leg, that is the tibia and the fibula, form the ankle joint, whereas the calcaneum, which is the heel bone, this is the largest bone in the foot. So the foot, which is divided into three main regions, that is the forefoot, midfoot, hindfoot. The forefoot contains the five toes, that is the phalanges, and the five longer bones, which are the metatarsals. The midfoot comprises of five bones, that is the three cuneiforms, medial, intermediate, and the lateral cuneiform, cuboid, and the navicular bone, whereas the hindfoot, which forms the heel and the ankle, the talus bone supports the leg bones, that is the tibia and fibula, and forms the ankle joint, whereas the calcaneus, it forms the heel, and it is also known as the heel bone. So coming to the arches of the foot has three arches, two longitudinal, that is the medial and lateral arches, and one anterior transverse arch. These arches are formed by the tarsal and the metatarsal bones, and they are supported by the ligaments and the tendons in the foot. So starting with the medial longitudinal arch. The medial longitudinal arch lies medially, that is when we talk about the exact location of the medial longitudinal arch, we can say that it lies between the heel bone, that is this is the heel bone, that is the calcaneum of the foot, proximally and distally the three metatarsophalangeal joints. So the medial longitudinal arch lies between the heel of the foot and the medial three metatarsophalangeal joints. It is higher than the lateral longitudinal arch. Then, as we have discussed before, the framework of the medial arch is formed by the bones. Now, which are the bones which are involved in the formation of the structure of the medial longitudinal arch? So, the bones which are contributing in the medial arch are the medial three metatarsals up till their heads. Then we have the three cuneiforms. These are the three cuneiforms, that is the medial, intermediate, and the lateral. Then we have navicular bone, talus, and the calcaneum. So the entire hind foot, that is the talus and the calcaneum. Then we have the midfoot, which include the three cuneiforms and the navicular. And from the forefoot, we have medial three metatarsals up to their heads. Now you can have an idea why I have described in detail in fact, I have revised the osteo of foot just because you have to, it would be easier for you to memorize. So once again, if I repeat that the medial longitudinal arch, which lies between the calcaneum and proximally and distally the three metatarsophalangeal joints. And when we talk about the bones which forms the medial arch, we can say that the from the forefoot the contribution would be from the medial three metatarsals up to their heads. Then from the midfoot we have three cuneiforms, that is the medial, lateral, and intermediate cuneiforms, and the navicular bone, and the entire hind foot, that is the talus and the calcaneum. Then there are the pillars. What are the pillars? Pillars are basically the structures on which the arch rests. So the anterior pillar consists of the medial three metatarsal heads. Now you can see these are the metatarsal heads, so they form the anterior pillar, whereas the posterior pillar is formed by the calcaneus. So we have discussed the structure of the medial arch, that how the medial arch is formed. Medial arch is formed by the bones which have been contributed from the forefoot, midfoot, and the hindfoot. Then the medial arch rests on the pillars. On the pillars, the pillars have been formed by the forefoot. They are the three metatarsal heads, and from the hind foot, that is the tuberosity of the calcaneum, which forms the posterior pillar of the medial longitudinal arch. Then, in addition to the pillars and the bones, we have the ligaments which actually support the arch. Bones which are forming the architecture of the arch. Then we have the pillars on which the arch rests. Then we have ligaments which actually support the arch. The first of all, we have plantar aponeurosis. Now, what is plantar aponeurosis? Plantar aponeurosis, which is also known as the plantar fascia, and it is actually a strong layer of white fibrous tissue located beneath the skin on the sole of the foot. Then the next support would be from the spring ligament. What is spring ligament? It is actually the plantar calcaneonavicular ligament. If you can see in the picture, this is the plantar calcaneonavicular ligament, which is also called as the spring ligament. It is a thick, broad, fibrous band that is located on the bottom of the foot. It connects the navicular bone with the calcaneum. Then it is further supported by the talocalcaneal ligament and the anterior fibers of the deltoid. Then lastly, the muscles which provide additional support to the arch. These muscles are the flexor hallucis longus, flexor digitorum longus, abductor hallucis, flexor digitorum brevis, and tibialis posterior. So this is all about medial longitudinal arch. If I have a quick review regarding regarding the medial longitudinal arch, I can say that the medial longitudinal arch, which lies between the calcaneum and the medial three metatarsophalangeal joints. This arch is relatively higher than the lateral longitudinal arch. Then the architecture of the arch, or the framework of the arch, is formed by the bones, and the bones which participate or contribute in the formation of the medial longitudinal arch comes from all the three sources, that is from the forefoot, midfoot and the hindfoot. From the forefoot comes the three metatarsals up to medial three metatarsal. Now you have to mention it, that is they are the medial three metatarsal, because we are discussing the medial longitudinal arch. Then we have the three cuneiforms from the midfoot, that is the medial, intermediate and the lateral cuneiform. In addition to it, we have a navicular bone also from the midfoot, and finally we have talus and calcaneus from the hindfoot. Then the medial longitudinal arch rests on the two pillars. So these pillars are formed, obviously anteriorly lies the medial three metatarsals up till their medial three metatarsal heads, and posteriorly would be the calcaneal tuberosity. Then the arch is supported by ligaments and muscles. The arch is formed by the bones. They rest on a pillar, the anterior pillar and the posterior pillar, and they are further strengthened by ligaments and muscles. So the ligaments which support the medial longitudinal arch are the plantar aponeurosis, the spring ligament, talocalcaneal ligament, and the anterior fibers of the deltoid. Then we have the muscles which further strengthen the arch. They are the flexor hallucis longus, flexor digitorum longus, abductor hallucis, flexor digitorum brevis, and tibialis posterior. So, moving to the next arch, that is the lateral longitudinal arch. Now, the bones, again, we will follow the same pattern. That is, first of all, the architecture or the framework of the arch, how the arch is formed. Obviously, several bones are involved which will form the arch, just like the medial longitudinal arch. So, the lateral longitudinal arch is formed by the calcaneus, the cuboid, and fourth and fifth metatarsal. So again, the contribution from the forefoot, midfoot and the hindfoot. From the forefoot, the fourth and the fifth metatarsals, because this is the lateral part. Then from the midfoot, we have the cuboid, and finally from the hindfoot, we have the calcaneus. Then obviously the pillars on which the arch rests. Anterior pillar is formed by the fourth and fifth metatarsal heads, whereas the posterior pillar is formed by the calcaneus. Excuse me. The arch is further supported by the ligaments. So the ligaments would be plantar aponeurosis, long plantar ligament, and the short plantar ligaments. Then the muscles which further strengthen the arch are the flexor digitorum longus, abductor digiti minimi, lateral half of flexor digitorum brevis, and the three fibularis, that is the fibularis longus, fibularis brevis, fibularis tertius. I know it's a bit difficult to learn the ligament and the muscles which are supporting the arch, but obviously we have to do this. So the lateral longitudinal arch, which are formed by the calcaneus, cuboid, and fourth and fifth metatarsals, they're pillars on which the lateral longitudinal arch rests. That is, the anterior pillar is formed by the fourth and fifth metatarsal heads, whereas the posterior pillar is formed by the calcaneus. Then the arch is further strengthened by the ligament. So the ligament here in case of lateral longitudinal arch is the plantar aponeurosis, just like the medial longitudinal arch. So the main ligament would be the plantar aponeurosis. Then we have the short plantar ligament and the long plantar ligament. Regarding the muscles, we have lateral two tendons of flexor digitorum longus, abductor digiti minimi, lateral half of flexor digitorum brevis, fibularis longus, fibularis brevis, and fibularis tertius. So we have discussed the two longitudinal arches, that is the medial longitudinal arch and the lateral longitudinal arch. Now coming to the transverse arch. The transverse arch is formed by the metatarsal bones, the cuboid and the cuneiform bones. Now metatarsal bones come from the forefoot and the cuboid and the cuneiform bones come from the midfoot. So no contribution of the hindfoot in case of transverse arch. Then the transverse arch rests on the two pillars which are formed by the medial longitudinal arch and the lateral longitudinal arch. Now you can see we are following the same pattern. So it would be easier for you to learn. Just have a concept regarding the arches and then learn it accordingly. That is, first of all, the architecture of the arch, which is formed by the bones. Then according to the picture, just learn according to the picture, so it will be easier for you to memorize. After doing with the bones, then come the pillars on which that arch rests. Obviously the anterior pillar would there would be anterior pillar and the posterior pillar. Then the arch is further supported by ligaments and muscles. And I know it would be you have to learn this thing, the name of the ligaments and the muscles. Then the ligaments in case of the transverse arch, they would be the ligaments which lie between the cuneiform and the bases of the five metatarsal bones. Then the muscles would be the tibialis posterior tendon, transverse head of adductor longus, and the fibularis longus tendon. So this is all about the three arches, that is the medial longitudinal arch, the lateral longitudinal arch and the transverse arch. Then what are the function of these arches? The function is basically to these arches spread the body weight to the weight bearing points of the sole. Example, heel, balls of the toe, primarily those of first and fifth toes and lateral border of sole. In addition to it, they also serve as shock absorber by their spring-like activity. The concavity of the arches protect the nerves and vessels of the sole. Then we have another thing to discuss in the arches of foot, and this is the plantar fascia. Plantar fascia is a thick web-like ligament. Now you can see that this is a somewhat web-like ligament that connects the heel. This is the calcaneum, the heel to the front of the foot. So the plantar fascia basically connects the heel with the front of the foot, and it is a thick web-like ligament. It acts as a shock absorber and supports the arch of the foot and thus help in walking. But plantar fascia becomes most of the time becomes inflamed, and when it got inflamed, the condition is called as plantar fasciitis, and this inflammation causes heel pain and stiffness. The causes of plantar fasciitis are overweight or obesity, long distance runner, high arches of very flat feet. The treatment would be rest, icing, using braces and anti-inflammatory drugs, and the most important is the physiotherapy. It is the key part of treatment for the plantar fasciitis, the physiotherapist would recommend several exercises which will help to overcome the fasciitis or the inflammation. Then we have another term which is called as pes planus, a condition in which the longitudinal arch in the foot has not developed normally and is lowered or flattened out. One foot or both feet may be affected. So actually what happened in case of pes planus, that is the longitudinal arch, that is the medial or the lateral longitudinal arch, either it is not developed properly or it is lowered or flattened. That is, it is present but it is low as compared to the normal, or it might be flat, and it would affect either one foot or both feet. Then we have another term which is called as peskevis. In pes planus, we have discussed that the arch is not developed properly, so either it is flattened or lowered. But in case of peskevis, we have excessively arched foot, that is, or it is claw foot. And this is basically this condition usually is as a result of neurological disorder such as Charcot-Marie-Tooth disease and the poliomyelitis. So this is all about the